Hey guys, welcome to The Daily Rinse, a podcast about dentistry and everything related to it. I'm your host, Peter.
And this is Abdullah.
So today we're going to be talking all about crown. Now what a crown is a restoration that fits over your entire tooth, sits on top of it, it's cemented inside, and basically it encloses your entire tooth and acts as a replacement for what was there before.
And usually this procedure takes about 2 appointments. Today we're going to talk about what dentists usually do perform in the first appointment, which is reducing the tooth structure and creating the surface for placing that crown or temporary that day. So today we're going to try something different on this podcast or this video. We're going to actually walk you through what we would do in the preclinic prep tooth number 15.
Yeah, we're going to show you the whole step-by-step process. So we're going to show you the instruments we use, the way we sit, the way our mannequin works, how to make everything that involves starting the process, how to get through the process, and then how to finish it.
And also the reasons we're doing certain procedures. What are the purpose behind them? First, we're just going to start the video. First, we're going to we set up the station and we put our brown paper, and this is our preclinic, which is extremely nice. And now we're just going to walk into the wet lab to create our reduction guide.
So lab putty has got a consistency a lot like Play-Doh, and it doesn't harden when you work with it until you put something called an activator, and that's this blue stuff that I'm about to put on it right now.
By the activator, you have to mix it until the color turns from pinkish to a purple color, and that means the activator is thoroughly into the putty.
Yep, and now we're going to rush back to the lab station because once you put that activator in, you are now on your working time and it's hardening as we speak. So we're going to want to fit this over the tooth that we're going to work on ASAP. So before we take a drill to it, before we take a burr to it and start cutting tooth away,
after the lab putty is hardened, we can start cutting it at the different areas that you need. So now you fit the pieces, and it just goes in like a puzzle, and it's very, very helpful to have, and that you can actually even apply inside the mouth.
So what's going to happen is when we start preparing this tooth, you'll see that there's specific specifications that we need to have as far as millimeters that we take off of the tooth, and this just lets us keep track of that before it's too late.
So this is our fake patient. First year and second year dental students, you're going to be having a lot of that. So we're fitting the Typodont in there, and
the top and the bottom, the maxilla and the mandible, actually fit in there magnetically, so it's really cool.
Yeah, and that kind of helps you, like when you're practicing, during a practical or competency, you cannot remove the Typodont until you're done. When you're practicing and this is the first time you're doing it, you can pull them out. As you can see right here, these are the different burrs that we have. This is a burr called 850 burr, and we use it for interproximal contact.
This one is called a chamfer burr, so this takes off the sides of the tooth in something that we call axial wall reduction.
And that creates that chamfer shape. I'm actually going to draw it. So if this is what we're trying to achieve by reducing the tooth, this area on the bottom right here, the fact that it looks like this is called a chamfer finish.
So this is a super important burr for a crown preparation.
Right here, these are different burrs, and every single one is different. You got like some depth cutting burrs, and you got some occlusal reduction burrs.
We're going to plug in our high-speed handpiece right now, which is the only handpiece that those burrs fit into. We're going to set our speed using this electronic
speedometer. So it's very important to have loops, and we're going to have another episode that we talk specifically about how helpful loops are, and they make your life so much easier.
Yeah, magnification and illumination are key, definitely.
So right now we're starting with depth cutting burrs. And the depth cutting burrs are actually, they stop at a certain level. So technically, if you want to go 1 millimeter, this will make sure that you only go that depth.
Right.
Without going further. The tooth we're working on actually, we're trying to reduce 1.5 millimeter on the lingual cusps.
Yep.
Which are basically the one towards your tongue, and we're trying to go 1 millimeter on the buccal cusps, which are basically towards your cheek. So
the depth cutting burr just helps us make sure that you're getting exactly 1 millimeter and exactly 1.5. So right here you'll see Abdullah making the depth cuts.
And it's just quick. You just want to create like a couple of grooves. So basically it kind of gives you the depth feel, how far of reduction you want to remove. And these burrs are very helpful if you're trying to just get a feel to it.
Definitely. So now he's doing something called occlusal reduction, which is where he starts cutting away at the biting surface of the tooth. So what this step does is it actually makes the tooth shorter, which is very important for a crown preparation.
Because just like you're capping the tooth, so you want to reduce the amount of structure that you have in order to fit the crown on top of it.
Essentially, you're kind of turning the tooth into like a peg of what it was, and then this cap will like fit over the peg. So that's really what a crown is.
Yeah. So in the beginning, you switch between burrs. I personally like to switch between burrs, but I know dentists, after doing this a million times, they probably are just okay with using one burr and they can finish this in no time. For us, like the fastest that I've done a decent crown prep would have taken me like around 20-30 minutes. A dentist could do it in 15 or even less. Some of them are phenomenal.
So here's our first check with the reduction guide. As you can see, we stick something called a perio probe in there, and that's got markings for how many millimeters you're cutting. And you can see exactly what's being taken off the tooth.
Yeah, so you can already see the dark shadow. That's basically tooth surface being reduced. And now we measured it and we want to go even further. And that's why the reduction guide is very helpful for crown preps. So right now we're still doing the axial wall reduction, and we're going at much faster speed because this process, especially for a student, we take our time with it.
Definitely.
Because, like we said, usually a practical or competency, they give you about 2 hours. That's including scanning for our school at the University of Buffalo. We have to scan our tooth afterwards to basically compare it to an ideal prep.
Yep.
And throughout the step, you got to make sure you dry the tooth surface. You got to make sure at every step you're doing your measurements using the reduction guide. Really utilize that for the beginning until you're really confident of how you place the burrs and how you do it.
Another super important part about a crown preparation, especially that axial wall reduction that we were talking about with the chamfer burr, is creating something called a finish line. So that's the part at the very bottom of the tooth, and Abdul is going to show you in a little diagram here exactly what a finish line is.
So basically, like we draw this is what our crown prep would look like, and this is the tooth. The finish line is this area right here. The yellow. As you can see, it's the most gingival, but at the same time, it's outside of it, and it goes all around the tooth structure itself. Yep. And this helps you seat the new crown on top of it. And this is where it's very helpful, because you want to create that ledge shape in order for the crown to sit very comfortably and also very functional.
Yep, so the nice thing is the chamfer burr has actually got the structure built into it to create that finish line. All you have to do is make sure that you're going smooth and continuous, and you keep that finish line the same length, same width all the way around, and nice and smooth, and the crown should sit right on top of it.
So at this point, we have already broken the interproximal contact. Since this typodont only has the second molar, it's already assuming that the third molar has been extracted, so you don't have to worry about breaking interproximal contact on the distal. Again, the distal is the away from the midline. Now we're just basically like in the smoothing process. We're still smoothing the tooth, making sure everything is looking good. With that one, some people try to use indirect vision. I personally try to find positions without really ruining my back to look at it direct.
Yeah, if you pay attention here, you'll see Abdullah is moving around a ton, and that's a super important step when you're really doing anything, any kind of dental surgery, just because if you're not comfortable, the patient's probably not comfortable, and your back will not forgive you for it.
Yeah, and you gotta know that you're gonna be doing these procedures on a daily basis. You're gonna be doing them for hours a day. So you have to be very comfortable with your seating position. It's much easier to roll your chair around
for sure
than twist your back and move around, and that is very painful. So we're back again to even more occlusal reduction. At this point, I have switched to a finishing burr.
Yep.
I'm no longer using there are two different types of burrs. In our school, we have the green one is basically for a gross reduction. That means you remove a lot.
They have a rough surface, so they'll take off a lot of tooth.
The red ones that I'm using right now, which is called a finishing burr, and that just basically to smooth out the surface of the tooth. And that is very important because you want a smooth surface for the crown to fit in easily. So as you can see right here, we can see that the tooth structure is basically what you're trying to preserve the anatomy and everything, but you're just trying to make it smaller and also easier for the crown to be placed on top of it.
Yeah, basically we're doing all these things to the tooth because when the crown goes in, there's two huge things that we're concerned about, aside from how it looks, of course, and they're called retention and resistance. And retention is basically the ability of the crown to stay in place the whole time, and resistance is the ability of the crown to not break or fall out when you're doing things like eating or sleeping or anything else.
Yeah, so we're still at the finishing steps. This whole process, in the beginning, the first time we did, it did take a long time, as you can see, and that we figured out that we need to reduce even more. We just go back with the occlusal reduction, and we reduce we take out more tooth structure.
Yeah, we're always really careful to take off a tiny bit at a time, because once you've gone too much, there's no turning back, and you'll have to start over with a fresh tooth.
Exactly. You can reduce more, but you cannot add more tooth. During practicals and competencies, that's key. You just got to make sure that you're going at the right depth with the right angle. Angulation is very important. After creating the occlusal surface, we're going to jump into the
axial wall reduction,
which is basically the surfaces of the tooth on throughout. Look at the surface of the tooth. And right here you have that interproximal space. This is where basically you're creating a form for the crown to actually just an area for you to like put the crown.
And that's what we use the 850 burr for, because it's the thinnest one. It cuts nice and quick right in between the teeth and prevents the chance of damaging the tooth next to it, because that's another thing you have to be very careful of. If you damage the tooth next to it, you're in trouble. You got to keep that tooth safe.
And as you can see, we tried to preserve the cusp right here. So occlusally, we just reduced it to make it smaller, but you can still see that there is the cusp right here, a cusp right here, and there's a groove in the middle. So now this crown, this is ready for you to place a temporary crown on top of it.
Yep.
Now, for most of the time, this is the first appointment. On average, dentists about less than 1 hour to do the whole procedure for both of them. For us right now, that would take about 2 hours.
Oh yeah. No.
And also you have to take impressions. That's also very important, because basically after this is done, we place the temporary crown, and then the patient goes home with temporary crown. 2 weeks later, usually the dentist will call in for another appointment. In that time, the lab would have prepped a crown. There are different methods. Now we're moving forward with dentistry. You can have a crown prepped within 30 minutes using a Serect machine in your office, and I've seen those. They're very incredible, and I'm sure moving on there'll be less reliance on lab work, and you can do everything in one appointment.
Definitely more.
So once again, thank you so much for tuning in. This was our third podcast, and this was a little more informative about what we do on a daily basis. So please like, subscribe, and share our video. And if you have any questions, make sure you send us a message or an email. Make sure you fill out the survey at the end so we can figure out what type of videos we're going to make in the future.
Thank you so much for watching, guys. See you next time. It's kind of like having the patient with you all the time in a very convenient form.
And yeah, so